We're not going to sugarcoat this one. Halloween is all about eating candy, lots of it. That, of course, can mean problems for your kids' teeth. Well, Dr. Theodore Wu from Buyback Dental has a program where you can actually have the kids learn something about charity, make some money, get some free little goodies, and still be able to eat a little bit of candy, right?
Well, that's right. This is our second annual candy buyback. And, for Monday to Friday after Halloween, we're offering children to bring in their excess candy. I mean, we're not talking all their candy. We're talking the excess candy. And we're giving them $5 for the first pound.
Terrific.
And $1 each additional pound.
So where do they bring the candy? To Buyback?
To our office, yeah. They can drop it off, after school or whatnot. They bring it in. We'll weigh it.
Okay.
The candy goes off actually overseas. It's a very charitable thing for the kids to do. They can sign a card for the troops, and they get paid.
So you're going to be collecting all this candy. It's going to be going overseas to the troops so they can enjoy some of the candy, right?
Yeah, I mean, it's more than for the troops. I mean, the troops actually use this candy to, create goodwill with whoever they're going to bump into.
Iraqi kids or whatever.
What's excess to us? I mean, kids don't need all this candy. I mean, after that Monday or Tuesday, they're going to have a ton of candy left over.
And the nice thing is you're stretching this out for the entire week, so if the kids want to eat the candy Sunday night, maybe a little Monday or Tuesday, they can come in Wednesday, right?
Yeah, I like sugar as much as the next person, but I think it's important nowadays to, with childhood obesity and diabetes, we need to watch out for the excess.
Right.
Moderation is the key. So
what's the best way to kind of gauge it with your children? Because they're going to be coming home, they're going to have the bag of the candy, they're going to want to keep it forever and just dip into it from time to time. What do you tell parents about that?
I think kids should pick a handful of their favorite candies. Pick quality over quantity. Mm-hmm. The rest of it, save it, and bring it to us. Or there's a lot of dentists that are doing this.
Right.
And what we can do with the excess candy is use it for a good cause.
How bad is candy for teeth?
I mean, that's a trick question. Candy itself is not bad. I mean, if you eat it sparingly,
right.
It's a treat. Candy, the frequency of it is a problem. Sticky candies, they wreck orthodontic bands.
Right.
If they stick on the teeth for more than a few minutes a day, you're causing a lot of acid and food for bacteria, and kids are susceptible.
How often should kids brush and floss, and adults? Twice a day?
2 to 3 times a day.
Yeah.
Flossing
is the key, isn't it?
For adults.
Yeah.
Flossing is the key. Kids just need to know what are good foods to eat, how to take care of their teeth, how to brush.
Okay, and we've got the sign up there. If you want to bring the candy by to Dr. Wu's office, just do that, and all the candy goes over to the troops, and the kids get to write a little card, and so they learn charity, they get their candy, they make some money, $5 for the first pound, and then $1 for each additional pound, then they can go buy something nice for themselves if they want. So
you're right, we're in
it's a great
the heart of Buyback Square, and there's a new Toys R Us downstairs. So
there you go. You don't have to go far to find something fun. Good to see you, Dr. Wu.
Good.
Thanks for coming in.
Thanks,
Rachel, over to you.
I'm sure you don't even have to ask kids twice for that. There's Toys R Us right down there. Okay, great. All right, right now, guys.